Hello, everyone. My name is Steve Stump. You are watching the Health Insurance 411. Today, I've got a really good episode because I wanted to talk about a study that was done last year in 2021 by the Becker's Hospital Review. And it studied a trend that's been going on for a number of years, several decades, in fact, where doctor ownership is increasing year over year over year. And those that own it are hospital organizations, private equity firms, and insurers. And as of last year, 70% of doctors are owned by some kind of corporate entity. What this means is 70% of doctors are effectively employed and they're not independent, meaning they are not small business owners like the practice began so many years ago. They are now employed by large corporate entities. Again, they're employed by hospital organizations, private equity firms, and insurers. 70% of them to that fact. And this has big ramifications to the relationship you can have with your doctor and the care that we actually get in the US. So I want to talk about those ramifications. But before I do, if you haven't liked one of my videos or shared it out with others, please do so. It helps me share this information with others and create awareness with the issues and concerns in the health insurance space, which I try to address on a daily basis. So let's go back to what this means. If 70% of doctors are now employed by companies, what does this mean to the type of care that you could receive? All right. So let's think about this in respect to your own life. Let's say that you and the family go out for a night on the town. You're going to go out to dinner and you go to a restaurant that you typically go to. And that particular night, the waiter or the waitress is really rude. It's clear that they didn't bring the food out on time, so the food comes out cold. You can't get any refills of your drinks. So really just the whole family has a miserable time, and it puts a damper on the whole evening. Now, you may decide you're never going to that one restaurant again, which is certainly your prerogative. But reality is that waiter or waitress will be there tomorrow and the next day because they're an employee. Unless you talk to the manager and potentially got them fired from their job, they are going to continue to be employed at that restaurant until they decide to leave themselves. Well, you can think of the same can apply to a doctor. So if a doctor is independent, I guarantee you they know what the average revenue is per patient in their book of business. And when they're independent, when they lose a patient, therefore a client, they understand that they've lost that revenue that was attached to that patient. So they're motivated to actually meet your needs, deliver great service, and not only are they motivated to do that to keep you, but obviously so that you refer to others and bring more to their practice. Now, if a doctor is an employee, how motivated are they to keep you coming the next time you need to see a doctor? So let's say, for example, you go see a doctor and their bedside manner is terrible. They don't listen to any of your concerns. They simply write a script and send you on your way, and you saw them in less than 10 minutes. Well, you may decide that that doctor is not the right fit for you. And if the doctor is independent, the money that they earn from you as their average revenue per patient just walked out the door. If they're employed, their bottom line potentially is not impacted whatsoever. Not only that, if they're employed with a large organization like a hospital network, a private equity firm, or an insurer, they may have so many patients coming to them in a day that they don't care that you walked out because these large organizations want to fill their appointments throughout the day, an 8, 9, 10-hour day. They want them to see as many patients as possible. So they're going to fill their appointment schedule with as many patients as the organization has access to. So the motivation behind the doctors change when they are employed. Here's another aspect that I thought was really concerning. Okay, so think about your employment situation. You go into work each and every day, and your employer trades your hours for dollars. So you give them hours, they give you dollars. Now, they may motivate you with more dollars. They may have a bonus contest within the year that drives you to perform at higher levels. They may provide promotions and raises for you throughout the year or once a year, all in the purpose of motivating you to do more for the company. Well, here's what the interesting thing is when a doctor becomes employed. Now, in Western society, certainly in the US, we live in a capitalistic society. And in a capitalistic society, the majority of people are motivated by money, doctors included. So I know they have to take a Hippocratic oath, but now there's a nuance in their motivation, and it's money. It's money driven. So what happens when a doctor becomes money driven and they're inside one of these large organizations, be it a hospital organization, a private equity firm, or an insurer? Well, let's hypothesize on what this potentially means. If they're inside of a hospital organization, that hospital organization has other doctors, other specialists. It has a laboratory. It has diagnostic imaging. And so doctors that work inside hospital organizations are now motivated to utilize the services inside the hospital network. And I suspect there is some kind of kickback provided back to the doctor for the referrals that they make to specialists inside the network, to laboratories inside the network, or imaging centers inside the network. So let's talk about private equity firms. So private equity firms is a trend in the industry that has happened here in the past decade or so, where these large firms, they pool money together and then they go purchase revenue generating businesses, and doctors and practices that they own are certainly revenue generating businesses that are good fit for private equity firms. But they also own standalone ERs. They also own diagnostic imaging centers, laboratories. They own a network of physician care providers, just like the hospital networks. And so these doctors can be motivated to keep the business within the affiliated businesses of the private equity firm. And so they no longer care necessarily that where they send you is the best fit for your insurance company or for your insurance plan or the best fit for your pocketbook. Now let's talk about insurers. This one is really, really interesting. So this has been a trend inside the industry for quite some time, and this one particular trend is kind of creating this environment that we see where it's a tug and a war from the care providers and the insurance companies. Care providers can be doctors, can be hospitals, can be ERs. It doesn't matter, but there's a tug of war that's been going on between these two organizations for, gosh, probably 10, 20, 30 years for an easy measure. But the tug of war happens because insurance companies, they have all the leverage or have had all the leverage in the past. You see, they bring the insureds to the care providers, and then the care providers have all these conditions and negotiated prices to participate in the insured's networks. Well, so what's happening is the care providers are forming and collecting and bringing more leverage to the relationship through their affiliation with hospital network, private equity firms, and whatnot. But when insurers own care providers, it really changes the dynamics, because now the insurer's motivation is to keep their costs down, and the care provider's motivation is to provide you great, excellent care and keep your health up. In my opinion, this is in complete conflict with one another, to bring the costs down but keep the health care up. Until we find a way to reduce the cost of healthcare in the United States that doesn't diminish the care that you get, right now, these are opposed points of view, in my opinion. And so when a doctor is employed by an insured, they are less likely to send you to a laboratory, to an imaging center, because that's additional cost that could potentially be put onto the insured. And so these trends are concerning. And with 70% of doctors now effectively employed by a hospital network, a private equity firm, or an insured, it's very concerning as to what's going to happen with healthcare in the United States over the next several years. And will this trend continue to ratchet up each and every year, approaching 80, 90%? I don't think it'll ever approach 100%, because there will always be doctors that want to own an independent practice, and they've carved out that niche, if you will, that will allow them to do this. But I do believe that the trend could certainly continue to approach 80, 85%, and that's really, really quite concerning. So one of the things that you can do as a person going to see your doctor is identify their affiliations with these groups. Some of them are going to be behind the scenes and you're not going to know. You're simply going to have to ask. But for doctors that are affiliated with hospital groups, you can typically tell this right away. You go to their website and it'll be clear that they're affiliated with a hospital name. This will probably be like a regional hospital. These will be hospitals that you see across your area, across your metroplex. And the doctors are affiliated with that hospital group. The other thing you're going to have to do is understand whether they are employed by the insurer, and they're not going to disclose this on their website. You're simply going to have to ask, are they employed by the insured, or are they employed by a private equity firm? Chances are, if you go to their website, and the website's something like drsmith.com, then it's likely that they aren't going to be affiliated with one of these third parties and therefore an employee. Most of these third parties want to standardize their entire brand of doctors inside the industry. And so they're going to have a standard website. It'll probably be something like hospitalorganization.com/Dr. Smith. So this will be important for you to understand. Now, I tell people all the time that the healthcare industry is actually rigged against you. And this is just another situation where it's really just follow the money, and you start to understand why it's rigged against you. To find out more, check out my video on my website /rigged, and then let me know what your thoughts are. Well, I hope you found this informative. My name is Steve Stump, and you are watching the Health Insurance 411. Have a fantastic and amazing day.